After a fight that began more than 30 years ago, this could be a day of celebration for victims of HIV and AIDS. Doctors say a baby in Mississippi born with HIV has been cured. The baby received aggressive treatment just 30 hours after birth. The child would be the second human in the world considered cured. Dr. Anthony Fauci is director of the National Institute of Allergy and Infectious Diseases. Good morning.
Good morning.
Is this a cure? And if so, what are the implications?
Well, it's very likely a cure. The implications really need to be determined because you're talking about a single case, and it's really more of a hypothesis developing or driving situation where we need to see if this is going to be applicable. It looks like, under the unusual circumstances, that this is indeed a cure because the pediatricians aggressively treated the baby essentially immediately after birth, which is the time of infection, as opposed to waiting to see if the baby was indeed infected. It was an aggressive approach that proved to be correct. Whether or not this is going to be broadly applicable for children really remains to be determined. But it is an important finding because it's an important proof of concept that if you treat early enough, you prevent that virus from establishing what we call a reservoir, where it's very, very difficult to eliminate that after it's been established for a period of time. So they got to jump on the virus, as it were.
Mm-hmm. And just how often is it that doctors are able to treat a baby that's 30 days old so aggressively?
Well, that's really unusual because particularly in this country, where there's relatively good prenatal care, most of the time if a mother is infected, the mother is treated during the pregnancy, which dramatically lowers the risk of the baby getting the virus through the birth canal or at the time of birth. Under those circumstances, when a baby's born, you don't aggressively treat the baby. You give them what's called prophylaxis, which is a less aggressive therapeutic regimen that would happen in this case. And then you wait about 6 weeks until you can definitively prove that the baby is infected, and then you treat them. Unfortunately, if the baby's infected, then that may have given the virus a period of time to establish itself. So this is a sort of a change of a paradigm. We're going to have to start looking at the relative risk versus the benefit of doing it this way. It doesn't often happen in this country. However, in the developing world, where 1,000 babies a day are born with HIV infection, this could turn out to be considerably applicable, but it remains to be determined, again, to underscore that this is just a single case.
One last question. Is this the same cocktail treatment that is being used effectively around the world against HIV?
It is. In other words, it's a treatment regimen. It's a triple combination of drugs that you would use to treat rather than to prevent infection.
All right, Dr. Fauci, good to see you. Thank you so much.